Hello, I am a Special Olympics Florida Health Messenger, Marianne Gonzalez. I want to welcome you to Special Olympics Florida Race for Inclusion Speaker Health Series. The Race of Inclusion is a statewide campaign to support athletes of Special Olympics Florida to build a community where all people to be treated with dignity and respect. Because people with intellectual disabilities often struggled to get proper care. Today, we are going to talk about some of the reasons why. Our experts are going to discuss what we are doing well and what we can do better. I'd like to introduce our moderator, Cary D'Ortona. Cary is a top executive with Orlando Health and Special Olympics Florida Board of Directors. Cary, take it away.
Thanks, Marianne. Thank you, Marianne. That was awesome. You are a true legend within Special Olympics, and I am so grateful that you're here today, so thank you very much. Hello, my name is Cary D'Ortona. I am president of the Orlando Health Medical Group, and I'm also a proud member of the Special Olympics Board. Today, we are here kicking off the Special Olympics Florida Race for Inclusion Speaker Series. We've got a great group of panelists who I'm excited to introduce, and so let me go ahead and introduce everyone. Hopefully I don't butcher any names. I've got Sue Kassoff-Correia, who's a project manager with Oral Health Florida. Welcome, Sue.
Thank you.
I've got Dr. Marc Colaluce of All Florida Podiatry. I've got Jackie Davie of Nova Southeastern University, and then Dr. Nadine Girgis Hanna of Dr. Dan's Family Eye Care. From now on, I'll call you Dr. Nadine, which I hear is what you go by. And then my good friend, Sherry Wheelock, who is the president and CEO of Special Olympics Florida. So we've got a lot of questions today, so let's go ahead and get started. Sherry, I'm going to start with you, not to put you on the spot. But let's start with the basics. Could you describe and explain to the group what it means when we say individuals with intellectual disabilities?
Well, at Special Olympics Florida, we actually follow the American Association of Intellectual and Developmental Disabilities guidance. And so that guidance outlines some criteria on different levels of cognitive as well as different behaviors that would be associated with an intellectual disability. Some of those might be the way someone learns, so the pace and level of learning, also communication skills, different adaptive behaviors that would impact their daily lives as a result of the intellectual disability. Some of the common ones that intellectual disabilities that are part of our team at Special Olympics, we have individuals with Down syndrome that are competing with us. Fragile X syndrome is another one that is, we also have a lot of athletes that support and participate with us. Also autism spectrum disorder as well. And so I'm excited that we have a lot of parents that are with us today in the audience, which is exciting as well because obviously their perspective of as far as how their athletes are involved and participate and the level of advocacy that they provide is really important for us as well. And so at Special Olympics, we're just here to support at every level, and so we're very excited about the discussion on healthcare.
Awesome. And just so you guys know, I'm going to direct questions to each of you, but if anyone wants to add at any point, please feel free to jump in. We would love for this to be more conversational. So Dr. Colaluce, I'm coming to you. How do health challenges of people with intellectual disabilities differ from those faced by the general population?
I'm a little different than usual. Usually I'm on paper, but my daughter said you have to use the tablet, so she helped me do this. My 17-year-old said, you better not have paper. I did bring paper just in case. So basically, there are numerous health challenges for our individuals with intellectual disabilities, and some of them a little bit more than the general population. So we're looking at situations with obesity, diabetes, cardiovascular disease, lower life expectancy, which has changed tremendously more recently, which is wonderful, and some pregnancy complications. So sometimes what we find, and this is the wonderful thing about Special Olympics and what we do in our Healthy Athletes program in Florida, is we need a comprehensive panel of physicians. So when they come through Special Olympics events, They're able to see multi-disciplines all in one location, and our screenings are free. People don't realize that all the time. So we have to sometimes even tell the parents and the individuals with the athletes that it is a free screening. And they're able to come in and see us for myself at Fit Feet, Fun Fitness, Health Promotion, Healthy Hearing, our MedFest program for athlete physicals, Opening Eyes, Special Smiles, and Strong Minds. So 8 different disciplines that we can really help direct the athletes if they need further care, or at least give them some ideas and some insight to the problems they may be having.
Awesome. Dr. Nadine, I'm coming your way. Yes, sir. Are there health problems that disproportionately affect individuals with intellectual disabilities?
That is an important question because I think we all know that's true. As Marc just mentioned, diabetes, cardiovascular disease, respiratory disease, obesity. For speaking, I did my little hand thing because for Opening Eyes, I'm a pediatric optometrist, and I see patients of all ages. And vision is, of course, I mean, look at all the people in the audience who are wearing glasses or contacts. Vision is a huge part of life, and I find that it's just an area that a lot of people with intellectual disabilities don't have the chance to have eye exams because as a person with intellectual disabilities, you can't go to a 4Eyes or a Vision Works there's online vision screenings and vision testing as well. You can't order from Warby Parker and have something that's going to work for you. So that's the disparity that I think is important to address here. And because there aren't a lot of optometrists, podiatrists, dental hygienists who are comfortable, and that's what we're going to talk about today, who are comfortable seeing, I'm going to say patients, but athletes with intellectual disabilities. That's the problem. That's why we're here today to talk about this.
Awesome. Well done. Dr. Davie, heading toward you. What are some common misconceptions about healthcare for individuals with intellectual disabilities, and how can we address them?
I think that probably the number one issue is that clinicians don't feel comfortable doing evaluations on individuals with intellectual disabilities. And I would just love to say that you are capable. You have the ability to help those individuals because you have the skills and you have the training that makes you able to work with any patient. And I think a lot of the concerns are with communication. How am I going to communicate with this individual? And there are many things that you can do to help to communicate. First and foremost, speak slower, speak on simpler terms, try to avoid jargon. I mean, we do this with our regular patients, avoiding jargon. Making sure that you speak to that athlete or that individual just like you would speak to anybody else. And they can communicate with you their needs. They may not be able to verbally say it, but a lot of people do have the capability to have something like an augmentative communication device, using some sort of PEC system, which is a picture exchange system, these types of things, and just paying attention to their behavior. These will all give you the cues on what they want and what they need as individuals, because they are individuals. And you have the capability to do this. It may take some time, it may take some practice, but if you have it in your heart to see an individual with special needs, I would highly recommend it. It's very fulfilling.
Well done, thank you. Sue, how do our perceptions of people with intellectual disabilities affect the accessibility of quality healthcare?
Thank you. Excuse me. Thank you so much. Our attitudes and perceptions definitely impact our athletes. And I was just talking to our panel before we walked in. I became a registered dental hygienist in 2013. Went back to school much later in life. I had not had any interaction with people with intellectual and developmental disabilities. And I was very fortunate that because I had that public mind, that heart, that passion for public health, when the opportunity came to volunteer with Special Olympics, it truly was a gift. And I want to thank all of those parents out there for taking such good care of your loved ones and actually sharing them with us. So, and thank you. And I have to say, it is so rewarding. We have so much fun. But getting back to those perceptions, a lot of my fear when I first started, I was a student, and I came as part of my class. We were there to, at that time we weren't allowed to screen, but I was recording, and I'll tell you, I was fearful. I didn't know if I was going to offend somebody, either the coach or the parent. You really learn that we are dealing with a population of very unique individuals, and they're all fantastic. I do think that that stigma and bias does promote a certain amount of, where there's that obstacle in the way that does stand in the way. Also, communication barriers, trying to understand, and that awareness, because when I became aware that this was certainly, there was no great mystery. I'm a healthcare provider. My task is to educate that athlete. The mouth is attached to the body. This is the gateway to the rest of your oral systemic link, as we say, and really understanding the importance of education, because a lot of our athletes, when they come to us and we are showing them how to brush, they really do embrace that. They have so much fun. And we see those athletes on it from the area games. If you think about it, in Palm Beach, for example, they will see us maybe twice a year on area games, and then twice a year here in Orlando. And guess what? They're getting a lot of, they were applying fluoride varnish, a lot of the prevention that they require. But I do think that education, we do need a policy change. We do need that increased awareness. We need to establish robust programs, and I do think Special Olympics, because that awareness, we're all here today to bring that awareness forth. I do think that there's a movement. I love the work that Special Olympics does. As you can tell, I'm very passionate about. And I went from, oh my goodness, what am I doing here, to when's the next games? So I do thank you all for just being here and hoping we can carry that message. We all act as ambassadors. That's all I've got to say. Who's next?
That was perfect. No, you hold it, yeah. But I'm going to kick a little bit more on this. As you guys work with, this is one I just made up, so it's not on the list, so people are probably going to freak out. But as you guys are working with your peers and other colleagues, what are the things that they're most afraid of that you can help them with your experience to get over that hurdle, so then we can open up the gateway for more providers to be available for our athletes?
If I could take this, I'm a professor. So I see this day one when our students come into clinic.
That's awesome.
And I'm pediatrics, personally. Having students see that kids can be fun is probably one of the first things. And I said to them, if you have any fear, you will be surprised at how much gratitude you feel from working with individuals. And it's just really exposure. I think that my students, when they first go into clinic with us and they hear all of the activities that we do with the state games and with the local games, and we actually run something called Healthy Communities, where we have individuals who need extra attention, because in my field, we can't really do everything at state games. We have to bring them in, do evaluations, make sure that we can fit them with appropriate amplification if they're having hearing problems. So we see them quite a bit. It's really just exposure. And you would be surprised at how many of my students are emailing me, when's the next games? When can we do this again? And it's just really getting out there, getting over your fear. And if you come, I think you will be hooked, like all the rest of us up here are. I've been doing this since 2006, first in Pennsylvania and then coming down here to Florida. And I've been hooked ever since I first got involved and heard, hey, this is an opportunity. Since I work with pediatrics, it was easy for me to associate my skills that I know in the clinic and take them over. But I don't think you need to be a pediatric person, because most of the people we're dealing with are adults, and they have adult needs. It's just being able to listen to communicate and see what they want as an individual. It's really just all patient care.
Dr. Davie, I think you're spot on. When Orlando Health partnered with Special Olympics back in 2019, we had a lot of our physicians and our team members that were nervous about going to that first event, and the team said, trust us, if you get your team to one event, the tide will turn. And sure enough, just so rewarding and engaged, and now we don't even have to when there's a call for volunteers, people are lining up because they love the events and working with the team so much. So thank you guys. Dr. Colaluce, I'm coming to you now. You got your mic? What sort of systematic barriers make it hard for people with intellectual disabilities to get quality health care?
Hello? Yes, okay. So I kind of grouped it together with structural and systemic barriers. I find that, we were just talking about it as well. So in large communities, in large facilities, in large practices, sometimes it gets kind of to the bottom of the list. So our goal is to try to break down some of those barriers, if you want to call them barriers. Attitudes, policies, practices, discrimination to a degree. I don't like to use that word too much, but essentially we're trying to open those doors so we don't have to use that word any longer. It's a lack of awareness, maybe a more polite way of saying it. So we find, once we start opening these doors and teaching these things, that we learn more. I'm a podiatrist. My school of podiatry was in Miami, Barry University. We had 1 page of information on those with disabilities, and that was 25 years ago. Has it changed? No. 25 years. And so now we're starting opening those doors at Barry University. We're starting opening doors here. We want to get involved with at all levels. So students, first-year students, through 4th year, residents, externs, interns, clinicians, even medical assistants. So everyone can be involved and get a little bit more of the knowledge. If we start early, like any of us, with anything that we would do, if you start playing the guitar when you're young, you pick it up a little quicker. So if we start earlier in the process, I think it'll become more of a habit and more of an automatic for clinicians to do. So we're hoping that we can get clinicians to be open-minded in that matter, and that's once again where we talk about how we can involve everyone with Special Olympics. All the people I just spoke of can all volunteer. So at all those different levels.
Awesome. Dr. Nadine, how can healthcare providers be better equipped to address the needs of patients with intellectual disabilities?
Part of the issue, and something I wanted to bring up, we have parents here, as was mentioned earlier. You're here because you support your children, your athletes. There are a lot of people with ID who don't have that support, who are in group homes, who don't have the same access to care, who don't have insurance, like general insurance, like Humana or United Healthcare, any of those larger carriers, they have Medicare and Medicaid. So as Marc was just saying, it starts from teaching our students what to do, how to do, to feel comfortable. Okay, so we get to the level. They're out, they're practicing wherever they're practicing. They're accepting general insurances. But what about all of those, and we were talking about this as a panel earlier, what about all of those people who don't accept Medicaid? The practice that I work for, to be honest, we don't accept it. And that's why I do Special Olympics, and that's why I go out and volunteer my time. And it's not under my control, unfortunately. A lot of people have that same problem. It's not under our control, and that's a big issue in my opinion. So whether they're children, whether they're adults, if you don't accept Medicaid, you're not getting the care from a general provider, even if they feel comfortable doing it, unless they give their time outside of work. And that's why we have to engage, and that's why it's important to get people to volunteer with Special Olympics, because it gives us that platform to give the care that we can provide and that they deserve. So that's part. And then the other part is, it would be great to see them in a practice or a group home or whatever through the insurance, and I think that would motivate a little bit more, hopefully a few more providers and of different areas. Money is the driving factor a lot of the time, and that's a big disparity that I see. So whether you can give the care, great, but anyway. So that's that. That's my little semi-political insurance truth, if you want. But Sherry agrees. I mean, Sherry says it. So that's that. Now, for those of us who are teaching and are exploring and getting the students out, becoming practitioners, it's not that complicated. It's just not. After we get over the stigma, after we get over the, hey, how are you? What do you need today? Just like we ask every other patient. What else is there? I don't know. It's to me, it's simple.
Thank you for that. Dr. Davie, can you share some examples of successful initiatives or programs that have improved healthcare access for individuals with intellectual disabilities?
Yeah, so healthy communities, I think, is one of the biggest ones. We started down in Broward County in 2010, I believe, with something called Healthy Communities. We were able to partner with one of the adult day facilities, and we actually physically put in a clinic in that. Yeah, it was amazing. It was amazing. So we all came in once a month. I would take the students down, and we would offer a walk-in clinic for anybody who needed help with their hearing aids or who needed their ears cleaned. You know, we were able to provide this on a monthly basis. And I know a bunch of other people went in there as well. They started a program for healthy eating, exercise, eyes, dental. We were all in there rotating through. Unfortunately, that facility is closed down, but we've brought that back into our own clinic. So on a monthly basis, we bring people in and do the screenings. We partner directly with different adult facilities to bring the people in who needed evaluation. We would first go out and do the screening at these facilities. So not only are we helping people who are in the Special Olympics athletics program, but we're helping other people who may not participate. So we could go in, screen, see who needed more assessment, bring them into our own clinic, and we'd run the clinics on the weekend or whatever works best for them. And that, I think that was one of the best things that we've ever done, because that's the thing. We can do a lot of screenings, but where are they getting the services once they leave that screening? That's my concern. You know, how are we following up with these individuals? And that's one of the great initiatives with Healthy Communities. I know as of a few years ago, we've fit several hundred people with free amplification, 3 hearing aids do that. And I've screened probably hundreds of thousands of individuals. Just even something simple as cleaning out their ears, it makes such a big difference. So.
Thank you. Sherry, I'm heading your way. Can you talk about your partnership between Special Olympics Florida and Orlando Health and how it benefits the athletes that we serve?
Sure. Well, first, as I think everybody has shared here, that you have to have the passion, the interest in wanting to become part of Special Olympics and to treat persons with intellectual disabilities. And so I think that was what we saw from Orlando Health, was the immediate passion to want to not just be part of our games, and as Jackie said, we're doing other things together through Healthy Communities for the referral process and follow-ups. We've been nutrition classes with you. Also, it's been really great that Orlando Health has been using their medical group to also be like our sideline trainers and making sure that during the games we have healthcare that is high quality for the athletes. Many times I've heard how excited they are now to visit the medical tent because it's actually air conditioned. And so at our summer games, it's pretty hot. And that's really important too, because hydration is part of Healthy Communities, right? Especially in Florida, the need to stay hydrated. And so this year in particular, it's been very critical. So we've done things like that together just in healthcare, and we're working, as you know, with not only the pediatric side, but the adult side to create what we're calling a center of excellence. And I'm excited about that so that we can have a more holistic health home, as Jackie was just sharing, that where people could come at any point in time to be seen for a variety of different issues. And so that's very exciting. And then also on the fundraising side, I mean, you guys have been incredible, donors and very generous to sponsor us at the healthcare piece of what we're doing, as everybody here is part of, but also being our official medical sponsors for the Race for Inclusion that Mary Ann talked about earlier today. So our Race for Inclusion is part of this, obviously, is not just about fundraising, but it's about awareness and talking about issues that are important to us as well as our athletes. And so honestly, I mean, Orlando Health has just been a tremendous, our ad and partner for Special Olympics Florida. We're just really grateful for everything.
I'm grateful as well. For me personally, it's been very rewarding.
Oh, yes, and
partnership,
Cary's a very active board member. So I forgot to say that. Oh, that's terrible. Yes. We're thankful for Cary,
well, even
too.
beyond that, I love working with your team and the athletes. It's been very rewarding to me, and our team shares the same we love our partnership with you. And so, Sue, I'm heading to you now.
All right.
And this, having heard your first answer, I definitely think this is the perfect question for you. So how does working with individuals with intellectual disabilities make you a better clinician? And are there things that you've learned that carry over into your general practice?
Thank you so much for that question. And I will say that as a clinical registered dental hygienist, working in the clinic, in an operatory, with a few of the athletes I know from my own area down in Palm Beach County, the fact that they know me, and I have been able to provide treatment for them, and I've learned in the process, it's not a big deal. It's like you said. A lot of times, I don't know who in the audience is afraid of a dentist, okay? And then you say to me, because I'm the first line of defense when you come into the office as a hygienist, Robin can attest to this, you will always see a clinical hygienist or a hygienist first. Really it's a matter of trust. So I learned that trust goes both ways, it's mutual. So, and that personal satisfaction, it's almost as though the challenge that I put before me wasn't as great as I thought, and sometimes it is. Sometimes we have to find ways to adjust our treatment with, say, a bite block, or turning the lights off and just working from my loop light. And also, and really managing my time. If I know that patient is going to come in, and I need to prepare accordingly, I need to put a few additional minutes aside, because that is what is going to foster my relationship with those individuals. Once that's done, I know that it's safe to say if that patient, of course, money is everything, right? But having worked off a grant, and we have found doctors in our area who were willing to charge just the lab fee. I was able to provide my services pro bono. If every dentist, every practice out there would do that, we could really help a larger number of individuals, and that applies for all of us. It really is kind of a social justice issue, isn't it? When you look at what's fair for me what's good for me isn't good for you, and that's got to stop. And I do think that we are seeing that tide, that tidal wave. It's up to all of us to serve as a voice, to advocate for our profession, for our people, the people we serve. And working from a public health perspective, I can tell you how rewarding it is to be with the athletes or those people who come to me with intellectual disabilities. Other than that, given the fact that I graduated dental hygiene school and we had 3 hours for one part of your mouth, one quadrant, and then to have to go into a practice where you have like 1 hour, you learn time management very quickly. So one way or another, I always say, we get you through this appointment, we're gonna hold hands and we're gonna get that treatment that you need, and I hope you'll come back to me. And that applies to all my patients, but especially those with developmental and intellectual disabilities. Thank you.
Thank you very much. Dr. Davie, talk about the training that clinicians receive today about caring for individuals with intellectual disability. And then I'm going to ask a question that I know the answer to. Is it adequate?
So I personally give them lots of training, but I'm one in thousands of individuals who do training. A lot of our training comes hands-on. We may have a class here or there on developmental disabilities. We have a large swing in our community to address things like the needs of people with autism. But until you actually get into the clinic and get exposure to that, I think that's a little bit different. So I tend to show and have students come in where they spend at least a semester with me, where we're seeing people with special needs on a daily basis. And it's really just exposure. And a lot of times, I don't know if it's necessarily that they need to be different. whenever they're seeing somebody with intellectual disabilities, or just be accommodating. Because, I have plenty of people who are typically developing who need just as much care and hand holding as those with intellectual disabilities. And I actually find that my patients with intellectual disabilities are tougher than are typically developing patients. So I don't know if it's necessarily that we necessarily need more training, but I think the training needs to come in the fact that you can do it. You can do it as a clinician. You don't, get over your fear and just be out there to help. And did I answer all of your question? I think I kind of sidetracked myself.
I think so. You did.
Okay.
If I had to summarize, I think there's still opportunity for
There's
us to get
definitely.
in front of folks and train folks up front about how to care for individuals with intellectual disabilities.
Yeah, so I would hope that the training programs are doing this. I know that we have a big push at Nova Southeastern University to be partners with Special Olympics, and as long as there is opportunity, our students are going to be there and learning on the job.
Dr. Colaluce, get the iPad ready. I'm coming to you. All right. So talk about when you're caring for an individual with an intellectual disability, how do you involve them in their care?
Well, it starts out like any patient in an office, in a medical office. So we have to think about HIPAA. We have to think about doing things appropriately and involving sometimes a parent, sometimes a caregiver, sometimes a buddy or a housemate that may be coming in as a friend just for moral support. So that being said, we have to follow the guidelines and rules that are out there for us with all of our patients. I think educating is really, once again, the common bond seems to be that the more we educate, the more we can present, the more we can make the athletes involved and the individuals involved. So that being said, I'll give you a little story. I'm once again podiatrist, but I take my practice, your feet are connected with the body, right? So we treat the whole body. So I see a lot of things. I've had patients come back and say, well, why can't you be my primary doctor? Well, I don't know if the state of Florida would like that very much, but I try to help out wherever I can. So we're creating our charts, and we're being very thorough with our charting these days with all these EMRs and so on. And I called a primary doctor to ask about the status of an individual with intellectual disabilities. Because there's codes, there are ICD-10 codes, F codes and Q codes for different levels of intellectual disabilities and Down syndrome. And the answer of the entire practice, not just the clinician, was, I don't treat that, so I don't code that. And it's an underlying problem. So I think that after that, I saw the clinician again, and he said, hey, can you give me those codes? So I broke that ice a little bit, and I think we need to break it more, make those available. I had to search for them myself. It wasn't something automatically given to us when they gave us our codes. So they are available, and there are different levels. And I think the more we educate, the more that can be so that when you get a note from a doctor that's referring someone to you, you'll know and you'll be prepared a little bit better.
Anybody else want to add on how you communicate directly with patients with intellectual disabilities and include them in their care?
I just talk to them. Honestly, I just, I think it kind of surprises parents a lot of times. As I said, I'm pediatric mostly, but I talk directly to everybody who walks into my office, regardless of their age or ability. I always speak to them, and it's surprisingly, that really kind of turns people around and makes them feel comfortable. Because I've been following one person who was an athlete for years and has, she's kind of gotten some health issues where she can't participate anymore. But how she was the first day that she walked in versus how she is now, this woman will come up, if she sees me in public, she will attack me and be like, Dr. Davie, give me a big hug. But you really just need to communicate directly with them and just show respect. And even if they can't reciprocate and speak to you, it still makes a big difference.
Awesome. Dr. Nadine, how can we promote greater awareness and understanding among healthcare professionals about the needs of individuals with intellectual disabilities?
Thank you for asking that question. I was thinking about that when I was prepping last night. And so we're all part of our local, state, national optometric association, podiatric, whatever it is. So for optometry, we have this initiative that's called Infancy. And so any provider that's part of the Infancy program will see a child, regardless of anything, from 6 months to a year, because they're a part of this initiative, for free. No insurance, great. Not taking it. No insurance, great. Don't need it. So that is what I would love to see, obviously, for athletes, special pops, intellectual disabilities. Is that realistic? I don't know, but it exists, is what I'm trying to say. So that is on a national level, and it's just certain optometrists who are comfortable. Again, I'm pediatrics as well, just like Jackie, but I see adults as in addition. And as we're training the students, any student, future clinician who is comfortable seeing a child can also see any adult. So again, for us, for optometry, if they do the infant care, then they can do the adult care. And so we just need to be more communicative and say, there's no reason that you can't do both. So that for me was like kind of an eye-opener. If you're part of this initiative that's infant care, why wouldn't you see a patient athlete who has intellectual disability? Because you can. Even nonverbal, doesn't matter. Does an infant talk to me? No. Same thing. So that was the first part. So in the broader sense, not eye-part, not eye-related, I think we need to get, like, again, local meetings, national meetings, state meetings, and tell people and have not necessarily us, but people who are like us, who can talk to other clinicians and get the word out and be like, I'll help you if you want to communicate with me. That's one side. The other side would be some kind of general training. We have workshops at the meetings too. We have to get continuing education. We have no choice. I mean, So why can't there be there is continuing education for, there are different tracks. You can do disease, or you can do nutrition, or whatever it is. There should be more lectures or more workshops, training people, doing workshops for people who are interested, clinicians who are interested in treating this population. So it's out there. It's just kind of like down here. We just need to bring it up a little bit.
So we have work to do. That's what you're saying.
Yeah, exactly.
Mind if I add to that a little bit?
Yeah.
From the podiatrist standpoint, again, I'm not sure about the other clinicians, but how we give back to our medical community that volunteer, the state of Florida allows 10 credits of your biennial credits that you need to get for relicensure for pro bono work. So we've been able to use Special Olympics and our paperwork to write off those hours for them and give back to them, as well as referring patients to their offices and so on. But that's a big one. It's a big catch sometimes. 10 credits, it's a quarter of our credits.
That's awesome. That's awesome. Sue, what steps can policymakers take to ensure that healthcare systems are inclusive and accessible to all?
Thank you. First of all, I want to just say that my professional association, the Florida Dental Hygienists Association, worked very closely with Dr. Stephen Perlman to establish Special Smiles. It's going back quite a few years before I even became a hygienist. Our legislation, we fought hard legislation that would allow us to not just record, but to screen and also to place fluoride varnish. And not that many years ago. So that's a good place for me to start with my own professional organization, and the fact that we do so much volunteer work, and we are so united with the Special Olympics throughout our state, and I'm proud of that. I do think, though, some of the policy development that needs to take place desperately needs to address individuals with ID, and also training and education. I was working in one in a dental school just in their perio clinic, and also at Broward College, where I teach during the summer, and training is huge. Training and education, making sure that I'm talking to these students about their curriculum and their continuing education. What's the best way for them to get that continuing education? Volunteer with us. Go to Orlando, go to the Broward games, be there, show up. The skills that we have to screen if you're licensed, you can certainly look in a mouth and screen, and as long as you're calibrated, that's important as well. You're going to learn. And also our infrastructure, facilities that are physically accessible. I can tell you, I'm old enough to remember the time when if you were in a wheelchair, you weren't going anywhere. You were, so there is a lot to be said about how far we've come. Also, integrative care models. We looking at working multidisciplinary. So my experience with working in the past was always working with the case manager, also including the caregiver, whether it be a family member or somebody who's a social worker, care coordinator, public and community engagement. And I do think, getting back to what Special Olympics does so well, it's that awareness campaign, that constant communication. That's how we kind of, in a way, we desensitize people. We make them understand it's not so scary after all, right? And we're used to it. Also, technology and innovation, and that gets back to telehealth. Right now in dentistry, we're looking at medical and dental integration. It only took us 100 years, but we're there. We're finally there. we're getting there. And really, I think, there used to be a time when if somebody who had any type of disability didn't go out of the house. You were the shadow population, the hidden population, and there were no services. And that is starting to change. And I do think that with policies and, there are coalitions that are out there now, especially in the state of Florida, looking at reimbursement. It's going to be huge. In the meantime, patience, and also just starting to build that interest and encourage more providers to really become involved. So that's that.
Awesome. Dr. Davie, coming to you. You've touched on this a little bit, but can you expand? What strategies do you use when there are communication barriers between the healthcare provider and an individual that's a patient that has intellectual disabilities?
So first and foremost, I would say use simple language, clear and concise, reduce the level of jargon that you do. There are visual aids that you can obtain. We have a lot of iPads in our clinic, so I have downloaded alternative communication apps, and you can build those. If you're talking about teeth, you can build a page about teeth, and pain. Does this hurt? There are many different services that you can use. If the individual is deaf, you can use an interpreter over an iPad as well. So there's the Florida Relay services. All of these things are available for you and at very low cost. But first and foremost, just be simple. Use short sentences, clear language. And I think that's probably one of the best. I have to say, I'm also a parent of a child with special needs, and one of the coolest things I've ever seen was when he was screened for visual, and just getting the evaluation done where it was just a picture board, and they had him, point to the different pictures. There are ways to get around everything. It was, I have to say, that was impressive for me, being in communication sciences and disorders, to see that there are things out there that are available for your specific fields. So,
awesome. Dr. Colaluce, what advice would you give to other caregivers when talking about caring for folks with intellectual disabilities?
Easily said. Not always, but we're all about it here, so this is wonderful. So I'm finding a common bond and common statements going across the board here, which is really neat. So I'm kind of like, oh, you're taking the wind out of my sails. No, but it's all of our sail, right? So it's our one big boat here. So I think we're all traveling in the right direction. So some of the same things, I had my little pearls. One of the easiest things and the simplest things that I found that I've used in some of my lectures at the university as well is a little video that's online at specialolympics.org on how to speak with people with disabilities. And it's just 10 quick statements from the athlete's point of view, from their verbiage, they're videotaped. Really simple, really great. I use it all the time over and over again. It's changed names here and there, but you can find it online. It's really simple. And then, like we said about speaking to them individually, I think that one of the things that we did in our office, we had an individual with Down syndrome. It's been a patient now for about 25 years. So we're kind of growing with him. He came to us because the previous doctor would not see him unless he was in the podiatry chair. Wouldn't see him. Refused to see, wouldn't do it. So to this day, I sit on the floor. It's a little harder to get up now than it used to be. But I sit on the floor with Johnny, and we joke and talk and do all the things that we need to do. But I think the other thing, Johnny's a great patient to use. I wish he was here. But be comfortable, make the individuals comfortable, find a common bond. We have in Tampa, I'm in Tampa Bay, St. Pete, so the Rays, the Bucks, find a team they like, or a sport they like, or a musician they like, and then you kind of have that bond when you walk into the room next time. Hey, did you go to that concert? Or hey, did you see that team play? And it opens the door, reminds them that, hey, this is an okay place to be. Yeah, so I always kind of keep those things available. And then we said, of course, about speaking with them as well. But most of the research out there shows that the typical history and physical for someone with intellectual disabilities is going to be about 4 times longer than a typical examination. So you got to put the time in.
Can I know I have the next question, but if I could just add real quick.
Yes, you're on.
And just remembering that athletes, they're just like us. They want cute glasses like Sue's. I'm just, they would like to have, they like to match, I need 2 pairs of glasses, one for purple, one, whatever it is. It's just like the rest of us. I don't see why that should be any different. So on our level, Special Olympics has done, kind of moving into my next question, sorry. Special Olympics has done an amazing job of working with the vendors and the different frame selections, and they've had sports goggles, swim goggles, which we don't have enough of, but also Jennifer knows. Yeah. So Special Olympics has done an amazing job of working with the vendors, and they have been generous enough to donate what everyone else wears. It doesn't have to be different, and it shouldn't be different. It is the point. So thank you for that. But I could just paraphrase Cary. So that's
Dr. Nadine, you're taking my job, so you got it. and I noticed you didn't say that Dr. Colaluce and I have great glasses. So I'm a little hurt. That's okay.
Sue has the best glasses. I mean, beautiful. So it's just an example, but it's the perfect example of what we're talking about here today. And so other things that Special Olympics can do is, in my opinion, working more with group homes. That's what I like to do because they generally have less access to care. We have to go in and we have to be there. So that's a big area that I think there's a lot of help that needs to be. And let's see, sponsoring lectures, as we were all kind of talking about in our state associations, sponsoring, just Special Olympics Florida needs to be out there. And the general practitioner doesn't know all the different services that we can provide. And maybe a looped, like Marc was saying, maybe a quick looped video of all, opening eyes, healthy smile, the things that we do. So just things like that just a little more advocacy, just a little more out there. Those are the things that I think that Special Olympics can work on.
Thank you. And now I'm going to go to Sherry with the last question, and then we'll kind of kick it around a little bit. But let's talk a bit about Special Olympics Florida Healthy Athletes Program. Tell us about the different elements and how it really impacts our athletes.
Sure. Well, I think we've kind of talked about a little bit of that already, of course. But I do want to I know we have a long ways to go with what we're doing in health, but I have to give a shout out, honestly, to these providers, Orlando Health, and especially our team, though, because, in the state of Florida, in 2019, and we're almost back up there again, and now we do over 13,000 health exams annually. And holistically, as Jackie was sharing, the idea behind Healthy Communities is to connect the individuals not just with the health exams that we're talking about here today, but actually getting them to a local provider that will actually see them for follow-up care and ongoing treatment. And I think to put this in perspective, though, as you mentioned, we do need to do more. I know Special Olympics internationally is doing a lot for advocacy, but boots on the ground, I mean, this team does more than any country within Special Olympics, as far as health exams, engagement, ongoing community activation. So I think Africa did like 8,200 screenings, so which is great and it's important. So I just want to make sure. I mean, I know we're very cognizant that we have a lot of work to do, and I think that's important. But I think all of you have been tremendous advocates and supporters. And Mark, and I'm sure Jackie, I don't know the stats, but I think his practice changed from like 0 persons with intellectual disabilities, maybe 1, it was Johnny, until like now 75% of the people he sees back in St. Pete are actually persons with intellectual disabilities, and somewhere around that number, I think. So it's really impressive. I mean, as I said, passion has to be there. And so obviously dental is one of our critical ones. We talked about podiatry, hearing, audiology, and opening eyes. We actually have physical therapy, which is a really big piece of what we do through Healthy Athletes. Actually one of our board members, David Cato, who's not here, he's also a big clinical director for our physical therapy. And I think we do a lot in general health habits, and that's really important. Because as you mentioned, education, explaining to them why the mouth is so important to the whole body. And, we really spend a lot of time on that, which is part of Healthy Athletes as well, like healthy habits. Certain times with, surfing and other things we do, dermatology screenings, which are not part of our typical Healthy Athletes curriculum, but we make that possible because we think that's important, obviously, in the state of Florida. And so I think the goal is taking a holistic approach. That's why many years ago, I was actually lucky enough to be part of this dialogue about how much we would do with Healthy Athletes on the board of directors. And there was a lot of conversation around, when health got introduced into Special Olympics, is this mission creep? Like we're here to be sports. This is the core. Sports provides, the platform and the ability, the place where our athletes can shine. They can learn skills, confidence, become, better contributors into the community because of it. And so the idea of health was a little bit of a challenge, for people to get their hands around and get nervous around the mission creep. But I think we all 100% embrace it, both at the our team level as well as our board of directors level, to say that we feel that if you feel better, if you're physically active, if you have the glasses, the hearing capabilities, and you have friends, the social part of it, it makes you emotionally better. I mean, you're going to be a better person, not just on the playing field, but actually back in your school, in your workplace. And so I'm really proud that, as a organization, we took that approach. And so I think that's why all of you have been so involved for so long, is because you also have that same, focus. And to have Orlando Health now as that big champion for us on a big global, I think it's going to get global, because I think our pilot, our Center of Excellence, is going to really, I think, take us to the next level in Special Olympics. So hopefully, I don't know if I answered the question, but I just wanted to give you a feeling that, we are doing a lot.
You're the CEO. None of us are going to question you, so it's okay. Sure, you're fine.
No, but I mean, I think there's lots of work to be done. I think the insurance thing is a challenge when we look at the difference between seeing pediatric versus adult care. I think there's a lot of different contributing things, but I think it's something that we're aware of, and I think that's the first step. And then you said, as you mentioned, just continue to work with policy and to be part of the conversation. And doing this today is a really great moment for Special Olympics Florida. As Cary said, we just are so grateful for our healthcare volunteers and what you've given to make us a great organization and to make our athletes great. So thank you again. And we're really excited. If you haven't heard, we have 2 big events coming up in Central Florida that are tied into this series, a swim for inclusion, and then a 5K as well. And so Stephanie and Madison, and of course Monica Hernandez, who's an athlete leader for us as well, are here today. And so if you haven't heard about it, they're coming up in September and October, and they're really, really fun events. So I know Kaya and the Orlando City come out to support it, as you saw in the film, and of course Orlando Health will be there as well. So it's a really fun time to get together, and we do a really good celebration. It's a really good event. So we're just thankful for the community to come together, and a big shout out to Orlando Health for hosting this for us. We're really excited about what the future holds for all of us. So thank you.
Thank you, guys.